We're back and you're watching the Dr. Nandi Show. And when we left you, we had Dr. Dara and her amazing story. She's a psychologist with a history of bulimia. So Dr. Dara, you know, as things were going on, what was the breaking point? What really finally it happened that you said, this is it?
Well, my health had deteriorated. I competed in a figure show where I'd looked my best and the world was watching me, and inside I was just in so much pain. And later that night after my figure show, I ended up in the hospital. I had blown up so much, like the Nutty Professor, automatically from the intense amount of water. And at that point, when I'd gotten to the hospital, there was some significant health concerns. And what had developed is I had such reactions from the caffeine and the different diet pills. My heart rate was racing and there was water in my lungs from the immense amount of foods that I had eaten. And at that point I knew something had to change.
And you said something really critical, and I want people who don't have eating disorders to understand. You said even though on the outside you're competing at an elite level, inside you weren't well. Tell me your thoughts then, if you remember. What were you thinking? What did you feel?
Well, you're not feeling because you're numb. You're numb and you're completely preoccupied. I remember just being so caught in it that I couldn't see out of it. So if people had said there was a concern, I couldn't see it. And what I was doing was among other people that did very similar behavior. So it wasn't viewed as problematic if you didn't eat or if you altered your food, if you took different over-the-counter medication or drugs. It was what was to be expected when you're doing things like that.
And what I'm afraid of is, as I hear you speak, in social media, you hear people, and they have different terms from it. Biohacking, for example, how to like get past it, not being able to eat for such and such time, or eat something, take something else. It's interesting when you talk about it that more and more society gets obsessed with this. And I think they are as well. I mean, to a certain degree, that folks who have eating disorders, they fall even more prey to it, don't they?
Well, of course, because of the stigma. And if you do speak up, what are people going to think about you? And you know, eating.
I'll say it. They'll say you're crazy, right? That's the perception, and that's why we're doing the show, because this is a disorder, right? And now, when you treat patients, you know, do you use your personal experiences for that?
Well, without a doubt, because I get it and I understand it, but I can't always experience everything that my clients do experience. But what I know is that there's hope and that it can be adjusted, because typically what's going on for somebody with eating disorders is at the root there's trauma. Trauma doesn't have to be, it could be all kinds of a little t or a big T, but it's the way that the mind is perceiving what had gone on for them. And so there's a stuckness that happens. The mind is reading old information as being current.
That's right.
So even when I was in it, it didn't feel real to me. I was always in Groundhog's Day, thinking back in how it was, and I wasn't focused or present and able to see what was ahead of me.
And now you practice and you call yourself a rapid resolution therapist. I love that. Tell me about that.
Yeah, well, the founder is Dr. John Conley, and it's a treatment that's effective and fast, and it's at a multi-level modality so that you can really connect with people and clear it at the root where there's been negative connection. You know, our brain is like, takes it in like data, and so there's data that gets stuck, kind of like a computer, how it processes.
Yes.
And so that old information gets stuck, and with rapid resolution therapy, it replaces it with information read as being positive or a sense of indifference. Just like if I said to you, do you remember, you know, your favorite song when you were in 7th grade? You would come up with a song. If I said to you, do you remember a dessert that you ate as a child? You would tell me about it, and there would be an emotion that would be attached with it.
Right.
So in rapid resolution therapy, we attach a different emotion to it, or you just think of it as a food and it's not so exciting anymore.
That's awesome. And what she's talking about, instead of planting those weeds that have been there in your mind, you plant flowers. You plant flowers in your mind because a certain idea is now associated with a different emotion or a different experience, and then your program doesn't carry out. If you program your computer that every time there's this stimulus that you carry this out, you change the programming. So awesome. Thank you so much. I appreciate it. Listen, I know you're a therapist and you're treating people, but bravo from getting through what you had gone through and getting treatment. It's not easy.
Thank you.
Of course, I appreciate it.